making sure that they are, like, that we're focusing on strengthening their calves, stretching their calves, strengthening their tibialis anterior. So a lot of times with the shin splints, the pain is on right outside of the tibia. So, and then a lot of times, like, so if people tell you.
Medial or lateral? Medial or?
Medial.
Okay.
Wait, no, I thought it's
The red part, you mean?
Yeah, so the red part, yeah. So that would be medial.
Yeah.
But a lot of times, like, people will say that their shins hurt when they first wake up, like when they step out of bed. And then when they first start to run, and then it will gradually keep on getting worse. I feel like pins and needles in their shins. But again, a lot of it's like rest, ice, compression. Compression's really big. Making sure calves are stretched. And then again, strengthening anterior tibialis. It's really good. But yeah, we won't, I mean, I don't think we see that as often as the rest of injuries listed. So, automatically thought of someone else.
Who?
Neha.
Ed
I
has
think
this
she
too.
has, who?
Ed.
Ed does? Yeah.
Yeah.
I mean, so your plantar fascia, runs along the bottom of your foot, right? And so, again, tight calf muscles, that's the biggest one. So if you see someone that may have that, stretching their calves is a good one. And then again, ice, compression. Sometimes they do surgery. I don't see how that could help at all. I feel like that would make it work. Yeah, everything, it always says like surgery is an option, but obviously I feel like resting.
So my mom's plantar fasciitis turned into Achilles tendonitis.
So
Because it
that's
got so bad.
Yeah.
I mean, she didn't walk for like 6 months. It was horrible.
Starts on the heel, yeah. I mean, but the only, like, the thing that they said, so symptoms, pain on the bottom near the heel, after getting up in the morning, and then after exercise, not during. So they may not feel it during exercise, but afterwards they're like, oh wow, like, my feet hurt. And then another good way, so a good way to stretch your plantar fascia is like taking a ball, a cross ball, some sort of like a water bottle, and then kind of massaging the bottom of it to loosen it up. They do recommend not doing it too much, like you don't want to ever push it past its limits, basically. Kind of with anything. And then this is so a lot of times it could tear, so it could lead to a tearing, which is probably what happened to your mom. And then, or it's just inflammation, it's just really inflamed and kind of irritated at that point. But obviously it can get to where it's really bad and they can't even walk. And then it could lead to Achilles tendonitis.
Ah, sorry, yeah.
Which, so your Achilles tendon, that little guy right there, if you've ever seen it like rupture, it's disgusting.
Yeah.
It literally just looks like, ugh.
I had a client in North Carolina who had his torn by a horse.
By a horse?
Because he was I don't know what the word is, but the people that put the horseshoes on horses, there's a name for that, which is a weird name. That's what he did for a living. And the horse like kicked him right in it, and it completely like, yeah. And so his movement was so bizarre because of it. Like I remember it was a long time ago, so I wasn't as experienced as I am now. Like he was a hard client for me.
There's a horror movie with Paris
Oh
Hilton.
yeah.
With Paris Hilton, when somebody comes up from the floor and
They
cuts
slice
their
their fucking
Achilles
Achilles.
tendon, and that person just automatically just falls forward.
Oh my
So there's
goodness.
nothing holding them back. And I was like, wow.
Oh my goodness.
That's interesting.
So with the Achilles tendon, it's really, again, it attaches to your calf, right? So people they could be running too much, proper shoes, they're not warming up well enough. A big thing, like any of the injuries, they could not warm up well enough, right? So that's where like big warm up comes into play. Yeah, so playing sports that require sudden stops and changes. So you see this a lot in like tennis players, even, I don't know, football. Football would be a good one, basketball. But if their heel is warm, like to a touch,
Yeah.
And then any like tight calves, and then if they can't really flex their foot. because flexing of that is, if it causes a lot of pain, it's more than likely it's their Achilles tendon. So after they go to rehab or whatever and they come back, working on eccentric. So when you go up and then slow on the way down is big on to help with after.
Makes sense, yeah.
Just kind of making sure, and then of course stretching.
So if you had an athlete, and let's say you've already been working on eccentrics, not plyos.
Mm-hmm.
We've had cases where we start working just eccentric plyos after that. So landing.
Yeah.
Just focus on landing, not taking off, just landing. So you drop off a box, land.
Mm-hmm.
Drop off a box, land.
After
Instead of going
you've
up.
done.
After you've gone through your exact football. Like,
Yeah.
yeah.
Yeah, definitely. And again, like just not making sure you don't stretch it too far.
What
So
is the reasoning for the heat? Like, it's not an infection or anything, so why would
it's
the area
so
get hot?
you know what they say, like the signs of inflammation. One of them is
It's
heat.
heat.
So if it's warm, it's inflamed
Okay.
a lot of times. It's just another sign of inflammation.
So that doesn't make any sense, like, well, it does, but when I went to the doctor's on Thursday, he was looking for heat for infection. Like, couldn't heat also mean just inflammation?
I think it would be both, yeah.
Yeah, it could be mean both. Yeah. Rotator cuff injury. So we have 4 muscles of your rotator cuff, right? So you have your supraspinatus, infraspinatus, subscapularis, and I always forget this, teres minor.
What's the nickname for that?
Huh?
What's your nickname for that?
Which one?
For the 4 muscles? Sits. Wait, the
Oh.
sits. Supraspinatus, infraspinatus, teres minor, and subscapularis.
Yeah, I always forget the
Oh,
teres
good.
minor. That is a good sit.
Sits.
Never told me that.
Yeah, so I feel like this is really common in a lot of people, especially as people get older. You're gonna see it a lot, or if like a lot of rounded shoulders, which you see all the time, especially people who sit at a desk all day. If they have, like, if it's hard for them to bring their arm behind their back,
Yeah.
they're more than likely, like, their infraspinatus is probably pinching. You know, so it's could be inflamed rotator cuff. So some exercises to include: doorway stretch, opening up the pecs, sideline external rotation. You can start with no band at all, but really making sure when you do that one, you're setting your shoulder blade down and back before they open up. A towel is a good one to put in there to make sure they're keeping that good alignment.
So the worst thing you can do is just overemphasize the already bad.
Yeah.
You what?
Like the worst thing you can do is have them do something, but they're already doing it wrong.
So like his
So
shoulder
keep your
blade
shoulder-
isn't
Yeah.
down
Yeah.
and back.
I
And
know,
then,
you
of
see
course,
people
you
in the
can
gym,
always-
just grinding on that.
Yeah.
Yeah, I mean, ugh. High to low rows and then reverse flies.
What is the height of the row?
High to low, so the, it's up high, and then I'm rowing down low. So again, it's making sure it's basically all of those they're stabilizing, setting your shoulder in that good position. It's basically strengthening, so you're strengthening all of your tiny, I think of all of those as your tiny muscles that make one big muscle. So external rotators, you're strengthening those tiny muscles to stabilize that shoulder into a good position.
Yeah, I think, that's a good way of looking at it.
Yeah, I mean, I think adding for a lot of people, especially, I think age is really big on rotator cuff.
What is it? Age?
Age, yeah,
Yeah, for
age, sports. So say we have people coming, like softball, right? I need to make sure I always incorporate some sort of rotator cuff strengthening, because I know that if I don't, I'm gonna get a bad habit and I'm probably gonna have my arm hurt again, right?
Which rotator cuff strengthening, for the most exercises we've gone over are external rotations.
Which what?
External rotations. So you're externally rotating your
Yeah,
shoulder.
yeah.
Most of them.
So again, it goes back into posterior.
Exactly.
Not internal.
Not yet. Definitely not internal.
Yeah, yeah. You rarely.
And what's a way that most people like to do internal rotation of your shoulder?
What's the way?
Yeah, like what do most people like to do?
Chest press.
Yeah,
Yeah.
internal rotation of your shoulder.
Yeah.
Exactly.
People freaking love chest.
Oh, how do do you go back?
I mean, I guess I.
Alright, so elbow tendonitis, this is what I thought Steph had. Obviously does not.
Unfortunately.
What?
Unfortunately.
I know. So what was cool though is that there's a tennis elbow and then there's also a golfer's elbow.
What's the difference?
So golfer's elbow is medial, tennis elbow is lateral.
Okay.
But they're really similar on how it so a lot of times for instance tennis elbow, a lot of times people like gripping. So the name comes from tennis elbow because tennis players a lot of times they get pain in their elbow because they're gripping the racket, they're pronating, supinating, a lot of flexion, extension going on as it happens. So again, following injury, so when someone comes back after they said hey, I used to have tennis elbow, well then making sure regaining strength and flexibility. But avoiding high repetition as you do it. So don't do 20 at one time, work on stretching and then doing set of 10 and then going from there. Because they did emphasize a lot on don't go high repetition because think about they're coming from a long injury of tennis matches are long games that that's how they injured themselves was a high repetition.
So hold on. So you're saying should work on regaining strength and flexibility of the flexor pronator.
Mm-hmm. So front of your forearm, and then back of your arm. So flexion, pronation. So flexion. You can even do so say I'm seated, flexion.
Yeah, wrist curls.
And then you could even do do we have a hammer?
No. Well, we
Some
do.
sort of a something. Pronate, supinate. Pronate, supinate. Just a different way.
We used to do that all the time. That's actually an exercise in the 1x20.
That's supposed to be an exercise in 1x20.
We took it out.
We used to use it all the time. Just give somebody a bar and then start in the middle and then slowly go out to the outsides. What is it?
Is that silver bar with 2 black groups on the game?
Oh, the massage bar?
Yeah,
You
exactly.
use that,
Yeah.
Uh-huh.
Exactly. Yeah, good.
And then so this is golfer's elbow, medial side. I think it's funny. I had bursitis because I pitched. I had bursitis, my medial epicondyle. Terrible mechanics. Terrible mechanics. And then tennis elbow on the lateral side. So if people are pointing my elbow really hurts right in between the bony area, they're probably pretty inflamed in there. So I would stretch, go low reps, don't grip,
How would you stretch the elbow?
I would stretch their flexors and extensors.
So stretching
First.
their
Yeah,
forearm.
so stretching their forearm essentially. Because you can't stretch, only you can stretch the actual, joint is massaging it.
Right.
And that's not really a stretch, but, and that could be sensitive to touch
Right.
a lot of times.
I wonder if they use scraping for stuff like that.
I don't know.
Because if it's, it is when mine are inflamed, they hurt to touch. So I
Yeah.
don't want someone scraping. That's for sure.
Yeah, I would think that they wouldn't because it's so it's bone.
Yeah.
You don't really have a whole lot of tissue around that area. I don't know. Carpal tunnel syndrome. So this is really common too. I think there's a lot, especially women.
I think Linda has this.
Yeah, I think she does too. So funny thing, I was looking for a picture in the next slide, and I had carpal tunnel, then it had I can never say the arthritis that she has. Psoriatic, and then it had rheumatoid, and it showed the different on the hand. So you'll see, I'll show you so the sensation is usually these 3 fingers because it's your median nerve that's getting that the pressure is on.
Carpal tunnel.
For carpal tunnel. But then it was interesting when it showed rheumatoid. People have thicker knuckles when they usually have arthritis.
That's it.
So it showed that's where the pain is usually at. And then with the psoriatic, it was kind of it was lines. It was like lines down the arm, the fingers. It was really interesting.
Mary Olsen has, you see the rheumatoid. Her,
Yeah.
She has massive knuckles. So does Pat. Pat's got big knuckles.
Yeah, but so with carpal tunnel, there's pressure on the median nerve, and then that's what's causing there's like tingling sensations and pain. So a lot of times when it hurts them to go into that full flexion, that's why. It's because they're putting extra pressure.
Yeah.
So that's why, like, a lot of times when people go off of that median nerve, it's more comfortable for them. I've seen, like, working in a PT clinic, people come from surgery, terrible. So if you have carpal tunnel, don't ever get surgery because it's a waste of time. It's pointless.
Yeah.
You go through more pain doing it, I feel like.
So you wouldn't have them stretch like this.
So you would, but you don't want to go full way. So it's a nice, easy. Like, honestly, I wouldn't have them pull back because that's going to full flexion and extension, right? So because when they're down here, they're in that full flexion and extension, and that's where it hurts, right?
Yeah.
So I would avoid stretching all the way back. So again, they work on flexibility of the elbow, wrist, and fingers. So, I mean, even just stretching fingers, right? Doing a gentle stretch, like I would keep everything gentle with
I wonder
carpal
if they
tunnel.
use wall walks for, wall walks for that in therapy.
Mm-hmm.
Yeah.
Yeah, I've seen that. A lot of like opposition. So say they put their finger down, so strength on those fingers. So I'm trying to keep these down and just lift my ring finger, and then pinky, thumb. Just working
I have
on-
a feeling Linda has both. Like, she has a psoriatic and she has carpal tunnel.
She could.
Because she's been typing on a computer for like 40 years. She's had
It's-
the same desktop job for her whole life.
Yeah, it's really common.
Yeah.
So I had her do a gentle forearm stretch, seeing if that helped give her some relief. And it didn't cause more irritation.
Right, and
But-
with her, that's a win.
Yeah. But yeah, so like some causes, age, cyst, diabetes, repetitive motion is most common. So that's why you see a lot of people that are sitting at the computer. Like, I tell my mom all the time, I'm like, Mom, stretch, like keep your body moving.
Yeah.
A lot of like good posture movements.
One of her clients, who is it? Someone specifically has a certain type of keyboard to prevent that from happening.
Oh, like the
Like, it's
padding?
I don't know, like some ergonomic design that like, oh, not my client, it's my neighbor, Janine. She talks about that because she's on a computer, so it's like this, so it keeps her out of that position.
Yeah.
So we can also develop it doing too much push-ups or chest press or overhead press like this.
Mm-hmm. Yeah,
Because you're
exactly.
extending it.
Yeah.
I've seen a lot in sports.
What's another reason not let clients do that?
Yeah.
What's what?
It's another reason to not, like, you know, clients always wanna fall back into that bad habit of
Mhm.
rolling. That's
Yeah.
another reason not to let them,
Mhm.
right? Like, hey, you could develop carpal tunnel just from being a shitty lifter.
Yeah, exactly. Alright, so then I went into fitness assessment. So, a big thing, PAR Q. So basically the PAR Q, you're just seeing if anyone has cardiovascular disease. If they answer yes to any questions, send them back to the doctor. I feel like you've all seen this. Medical history, personnel history questionnaire.
This is what your clients fill out online.
Yeah. So we all see that. And then fitness assessments. So, resting heart rate, number of beats in 30 seconds, multiplied by 2, blood pressure, weight, BMI.
You really have BMI on that screen right now?
What?
BMI, really? What year was this thing developed?
No, it was on there. We decided it. But yeah, I don't think with BMI that you can really, because it would say I'm obese. I'm not obese.
I think everybody in this room is obese, according
Yeah.
to BMI.
Body
Speak
composition.
for yourself.
The only way that we could do it would be with skin calipers, and all other ways you'd have to send them off to, they're called like the pods. Something
Bod pod.
pods. What?
Bot pod.
Bod pods, yeah, bod pods. And then circumference measurements, just using using tape, just measuring the thickness of every.
So we used to use both skin calipers and circumference measurements. It just takes too long.
Yeah.
And people like it's invasive.
Yeah, it's pretty invasive.
So unless someone requests it, we don't do it.
But we have the skin calipers and we have the measuring tape
We do?
for that.
Okay.
Yeah.
What does, you know what hip to waist ratio can get you?
Your BMI. No.
No. Hip to waist ratio can determine whether or not you're at risk for heart disease.
Okay. Hip to waist ratio.
Yeah.
Okay.
There's a certain like obviously calculation.
Yeah,
for it, but
calculation.
I used
Yeah,
to do
all
that.
of these have
Yeah.
specific calculations.
In the website
EXRX.
EXRX will give you all of that. EXRX is a really good website for all those calculations.
Formulas.
Thank you.
Did it have the Rockport walk test?
I don't know.
Yeah.
Yeah,
Yeah.
that's what CES, my CES teaches you. Well, also just not the CES, CBT, the CBT and the CES give you the Rockport walk test. Or like the step test, whatever that is.
The whole it was a long calculation.
If you're good, you have a metabolic card.
If what?
If you're a legit facility, you have a metabolic card
Yeah.
where you just strap them in.
Yeah,
I always
it has
wanted to
20
do
grand.
that.
I did that for lab.
I took, well, that's what I'm saying. We had a lab, but I didn't get to do it. My teacher did it.
Oh really?
Yeah, she was the only one that got to do it.
We got to do it for
She
free
was
as students.
badass too. She would always run like with no shoes on.
On a rec center, you can just come in and do it as a student.
Oh really? We had to
3,000.
go. We went off to a different facility.
Oh, okay.
It was like part of it was personal training, part of it was physical therapy. Pretty cool.
Nice.
And then static and dynamic. So that's what we do. So when someone walks in, we automatically look at their posture. We look at their dynamic. So as they move, the 7 checkpoints. So ankle, knee, hip, lumbar spine, thoracic, shoulders, surrounding, and then head and neck. And then that's where, so all possible impairments. So a lot of times people, their feet turn out, or like they'll just walk with their feet turn out. I feel like you see this a lot with older, as people get older, their feet automatically, and I'm so curious on that.
Why it happens?
Yeah, why it happens on just older.
I don't know. That's a good question.
I don't think it's just older.
No?
Maybe you just noticed that.
Just know
I also think the sneakers make a big issue because they put a lot of arch support when somebody doesn't need
Yeah,
arch
I mean,
support, and
that's
it
very
pushes your
true.
feet out. Like let's say you have already good arch support and you put arch supported shoes,
Mm-hmm.
I feel like it's gonna want to push your feet out. But I don't know. I don't know research on that or anything.
But yeah, lack of dorsiflexion. Knees moving inward or outward, like when squatting. Pelvis anteriorly or posteriorly. Excessive arch in low back or rounded low back. Excessive rounding of upper back. And then protracted or hunched shoulders, which I feel like those go hand in hand. And then forward head. So they went on to that, and then they went on to different like functional assessments. So overhead squat assessment. Just overall, I mean, we do this
From the
one.
NASM book?
This one I had to look online. I couldn't
It was
find.
from the NASM book.
It wouldn't let me like take pictures from the book.
Yeah.
So I actually brought up the book. Does it look like it's from the NASM?
Yeah.
Yeah. But so this would be proper alignment when you're looking at overhead squat. Obviously, if they don't have, like, say they have tight lats, they're gonna lean forward. Their arms are gonna lean forward. Weak glutes, their knees are gonna cave in. Just overall strength and flexibility. This is the chart. So compensations,
This is CES right here.
yeah.
What it's basically telling you is, if this compensation is happening, what exercises should you do?
Yeah,
Right.
yeah, exactly.
Strengthening versus loosening.
Yeah, so let's go. So I said arms fall forward, right? So if my arms fall forward on overhead squat, I'm going my overactive muscles. So my tight muscles are gonna be in my lats, right? So I'm gonna foam roll, I'm gonna stretch my lats out, and then I'm going to strengthen my rhomboids, my rotator cuff, all those little rotator cuff muscles that I have. So squat to rows are example of an exercise.
So what if the person puts their arms down, they still fall forward?
Then I would look at their hips and their calves. Because me, for instance, when I, like a lot of times me, it's my calves.
Interesting, because the way, yeah, I mean, for sure.
'Cause if
CS
I were-
doesn't, unless it's been updated, but like when I did CS, they talk about core and hips,
Yeah,
right? So your hips, it's either gonna be your hips or just your lack of understanding of how to use your core.
yeah,
But yeah, calves make sense too.
yeah. Single leg, so single leg would only be used if you did not see anything in overhead. So say like they did a perfect squat, they're an athlete, they did overhead, you didn't see anything, then you go to single leg. That's where you can see more of, like a one side, like, so say like my right butt cheek doesn't fire like my left, then I need to really work on single leg, muscle work.
Yeah, we use this at the Yankees. We use both overhead squat and single leg on the box.
Yeah,
And I mean, there's a lot of people that come through these doors that you wouldn't even
No, you
get to
wouldn't.
any of this.
exactly, yeah.
Absolutely.
So we do this
A
one.
lot of assessment things are useless in our facility.
Yeah,
There's not needed.
yeah, I've noticed. So wall external rotation, we do this one. Obviously, so if I can't get my wrist on the wall, right, I'm tight here. Like I can automatically, right? So they just tell you foam roll, static stretch, and then good strengthening. So I should do my external rotation. I can do them sideline or standing. Wall angels, so just continue to do those. Eyes, or T's and I's.
You've been practicing your wall angels.
Mm-hmm. You can tell.
Yeah, I mean, it doesn't take long for it to get better, right?
I do them on the floor. I find it better on the floor.
Yeah.
Than I do them on the floor. Okay, so then they went into performance. So, like so say we got like a Yankee player or someone that's been working out for 2 or more years. Then we would do 1 repetition squat, deadlift, and then bench press. Other than that, you wouldn't want to do it.
Yeah. Makes sense.
Obviously.
Yeah.
Makes complete sense. Push-up test is just a good way to, I mean, we do that. We do push-ups. Just a good way to build confidence with your client, and then that's a way for you to kind of tell them like, hey, like, so I think Heather, my first day I came in, she specifically told me, she said, all right, so you got 10, so next day we're gonna get 11, and then, so it's just a good way to help them build strength and confidence in the same time.
Yeah, instead of saying, try to get 20, and then they fail on 15, and like, shit, you fail.
Yeah, exactly. Okay, so then this is what I was talking about with, what they talked about with corrective exercise. So this is where we would come into play. So say you see, I'm your client, and you see that my arms fell forward or whatever. You see that I have muscle imbalances. You're gonna inhibit, lengthen, and activate. That's what I'm talking about. You're gonna do foam roll, you're gonna stretch, and you're gonna activate my weak muscles. So, I just pressed escape.
It should be coming up. There it is. Just move around the bottom. Actually, no. Yo, man.
Okay, so this, it's on. So this is just, I love this, but there's this only new for me. So this is the book that I did it on. So this would be static. So we come in and so you see I have good posture just standing, right? So then these would be, so feet turn out, example of feet turn out, pronate. So if they have their foot pronates, you see this a lot when people squat too.
Mm-hmm.
Make this.
Wendy does that.
Yeah. Yes. Yeah.
I mean, she can correct it if you cue her on it, but if you don't cue her, she's like.
Yeah. Pelvis, anteriorly, posteriorly, rounded shoulders. So the neck is big on like push-ups. Like you'll see like if people, they like to like push their neck down, their head down, like it's
Like,
gonna get them
like,
down
drag it
farther.
further.
Yeah. That's a big one that you'll see on push-ups.
Also an overhead press, you see it.
Yeah. So this is where, and I just thought it was good. So you see top left, that's the proper overhead squat alignment, and then your top right, that's gonna be your knees fall in or out. See how she's arching the hips, forward lean. Da, da, da. And I just thought this was good to look at.
This is literally Corrective CES. Like you basically got a CES.
Yeah, but I didn't. I just got paint.
Just say you did. Just say you did. But you can put that in your thing.
We'll just copy mine.
There was something else. Oh, okay, so this one, form fix. Have you ever heard of that?
What's that?
It's literally just like a bar that, so you know how we always use like PVCs and stuff to like, for people's spine? That's what he's doing. But it's literally a tool that someone made.
Of course,
Yeah.
they made millions of dollars.
Yeah.
Well, FMS, their whole setup is expensive, and it's just a bunch of fucking holes and measuring.
Yeah. But yeah, that's it.
Awesome.
That's
That's
great.
really good.
Kind of a good refresher.
Literally CES.
Yeah, yes. It's definitely,
My
well, it's
CES
definitely,
book is in there.
definitely good, yeah. Good refresher for all the people we work with.